The Cal Poly Rec Center is always a hub of activity, but never quite like the last 10 days.
So we had private sector engineers, architects, we had doctors on site. This is an all hands on deck effort right now.
An astounding coordinated effort of cooperation has created an additional medical care facility for COVID-19 patients in our county.
And everyone stepped up and is doing things in lightning speed, working 16-hour days to get this done. Literally from can you do this to having it ready to turn over in just about 2 weeks.
This alternate care site will treat COVID-19 patients too sick to stay home, but not in need of the acute care of one of our 4 area hospitals.
We're running oxygen conduit, we're running electrical wires, so we're going to be able to provide oxygen at this facility. We're going to have vital signs machines, pulse oximetry to check people's oxygen saturation.
What is usually a good place to get a workout will now be a place to potentially save lives.
We're configuring the ACS to accept patients in phases. Phase 1 will accommodate up to 165 patients, and our overall plan ultimately allows for 931 beds.
That's more than twice our 4 area hospitals combined, which allows those to be used for most critical cases. The county is working with Cal Poly, our legislative leaders, administrators and staff from both Tenet and Dignity Health, as well as private contractors like Reach, RRM Design Group, Trust Automation, McCall Plumbing and Mechanical, and Toma Electric, so that this facility meets our potential needs. That means copper piping to run oxygen from tanks to patients in their beds, additional electrical wiring for oxygen concentrators where the piping can't reach, and new plumbing so medical staff can have proper scrub areas.
Short of anything that the military is doing right now in New York and other places, I think this is probably one of the premier facilities that we'll see in the United States and certainly in California.
This monumental task called for unprecedented ingenuity and teamwork, and for everyone to step outside their comfort zones. The buy-in from the community has been huge.
From President Armstrong of Cal Poly leaning in immediately to say, hey, we're going to make this happen in the community and we're part of this community and we need to provide this support.
To the doctors, county planners, private architects and engineers, and every employee assembling every single part.
Kind of different doing this job in particular because we're actually making a difference in the community.
It's the kind of job no one here imagined being a part of, and it's one they all agree they'll feel even better about if it's never used.
Pretty impressive for a group of people who have never really worked directly together, and they certainly haven't done this type of project together. It's professionalism and humbleness and willingness and ability to help that's made this happen. I think it's pretty amazing.
The first phase of this alternate care site is patient ready. Crews are working to finish phase 2 in another gymnasium on the west side of the facility, and 3 more areas are mapped out for the following phases. If necessary, a 6th is designed for Mott Gym and is ready to be implemented.
This is what our community can do on the Central Coast if we all pull together and we have a will to take care of each other.
The Medical Reserve Corps is staffing this site. We could use your help. To apply, visit readyslow.org.